In this video by Deckplate, we will understand the VA disability ratings for endocrine diseases other than thyroid and parathyroid, or diabetes mellitus. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA provides specific disability ratings for various endocrine disorders based on the severity of symptoms, required treatment, and the impact on overall health. These ratings allow veterans to receive compensation that reflects their level of impairment and the treatment required for each condition. Cushing's syndrome. Diagnostic code 7907. Cushing's syndrome is a condition caused by prolonged exposure to high cortisol levels, which can lead to symptoms like osteoporosis, muscle weakness, and hypertension. Ratings are determined by the severity of symptoms. 100% active progressive disease with severe limitations, including an inability to rise from a squatting position, climb stairs, or raise arms. 60% muscle wasting that prevents rising from a squat, climbing stairs, or raising arms. 30% presence of striae, obesity, moon face, glucose intolerance, and vascular fragility. Evaluations continue for 6 months after diagnosis. Afterward, rate on residuals under the appropriate codes. Acromegaly. Diagnostic code 7908. Acromegaly results from excessive growth hormone, leading to abnormal growth of bones and tissues. Ratings are based on the impact on health. 100%. Symptoms include increased intracranial pressure, visual field defects, arthropathy, glucose intolerance, and either hypertension or cardiomegaly. 60%. Arthropathy, glucose intolerance, and hypertension. 30%. Enlargement of extremities or overgrowth of long bones. Addison's disease, adrenocortical insufficiency. Diagnostic code 7911. Addison's disease is characterized by adrenal gland dysfunction, causing weakness, fatigue, and potentially life-threatening Addisonian crises. 60%, 4 or more crises in the past year. 40%, 3 crises or 5 or more episodes in the past year. 20%, 1 or 2 crises, 2 to 4 episodes. Weakness and fatigability, or corticosteroid therapy required. Polyglandular syndrome. Multiple endocrine neoplasia, autoimmune polyglandular syndrome. Diagnostic code 7912. Polyglandular syndrome involves multiple endocrine disorders due to autoimmune activity. It is rated according to major manifestations including, but not limited to, type 1 diabetes mellitus, hyperthyroidism, hypothyroidism, hypoparathyroidism, or Addison's disease. Neoplasm, malignant, any specified part of the endocrine system. Diagnostic code 7914. This diagnostic code addresses malignant tumors in any endocrine organ, such as the adrenal glands or pituitary. 100% rating during active disease or treatment. Surgery, chemotherapy, etc. 6 months after completing treatment, a mandatory VA examination will determine if the cancer remains. If no recurrence or metastasis, the rating will reflect residual effects. Neoplasm, benign, any specified part of the endocrine system. Diagnostic code 7915. Benign tumors within the endocrine system are rated according to the residual of endocrine dysfunction. Hyperpituitarism, prolactin secreting pituitary dysfunction. Diagnostic code 7916. Hyperpituitarism is a condition where the pituitary gland produces excessive amounts of hormones. The evaluation involves determining whether the neoplasm is malignant or benign. Hyperaldosteronism, benign or malignant. Diagnostic code 7917. Hyperaldosteronism, a condition marked by overproduction of aldosterone leading to high blood pressure, low potassium, and other issues, is rated based on whether the tumor causing it is benign or malignant. Pheochromocytoma, benign or malignant. Diagnostic code 7918. Pheochromocytoma is a rare tumor of the adrenal glands that can cause high blood pressure, headaches, sweating, and rapid heartbeats. It is also rated based on whether the tumor causing it is benign or malignant. Thank you for watching this video. Please don't forget to subscribe and like our videos.